Doctors are warning us to be careful when gathering this Christmas as COVID continues hitting homes. For more Utahns, it is likely Omicron will quickly become the dominant variant in our state.
News specialist Jed Bull shows us what strategies doctors are sharing. They're familiar by now to stay safe for the holidays.
The Delta variant right now is responsible for the COVID hospitalizations and deaths in Utah. But an infectious diseases physician here at Intermountain Healthcare says projections show that Omicron will be the dominant variant by the first of the year.
The elephant in the room is the Omicron variant.
Spreading rapidly across the country. In northeastern states, a growing proportion of COVID cases now coming from Omicron, a proportion doubling every 2 to 3 days. Dr. Brandon Webb.
What that means is that this new variant is more efficient at causing infection, and it's able to outcompete Delta.
Webb says Omicron only represents 3 to 6% of Utah cases now, pending confirmation by sequencing. But that proportion will surge.
Going into the next month, that's concerning because we're projecting that the Omicron variant will significantly burden the healthcare systems because of its transmissibility.
New data shows the vaccines plus boosters protect against severe infection and death from either variant. If you're going to a large gathering, Webb suggests get tested or test yourself at home. Also, understand your personal risk.
If you are not fully vaccinated, the likelihood of having severe COVID-19 is much higher.
Even more so for adults with medical conditions like high blood pressure, obesity, diabetes, or other conditions that impair the immune system.
It's very important for individuals to understand their risk and to take appropriate precautions.
Social distancing, masking, and limiting the size of gatherings will work against Omicron, the doctor says.
The most important is not to gather, not to be in public. If you have symptoms that are consistent with a respiratory infection, please don't gather with individuals. Get tested instead.
Webb says vaccinations and testing early and often will be the best ways right now to contain this virus. For KSL 5 News, I'm Jed Bull.